Thank you for joining us for this session of the North Central Farm and Ranch Stress Assistance Center webinar series presented to you by the National AgrAbility Project. My name is Paul Jones. I manage the National AgrAbility Project, which is headquartered at Purdue University in West Lafayette, Indiana. A little background on USDA's National Institute of Food and Agriculture Farm and Ranch Stress Assistance Network, commonly known as FARSAN. It was first authorized under the Farm Bill of 2008, and its goal is to establish a nationwide network of stress assistance programs to help people involved in agriculture or in agriculture-related occupations. There are 4 regional centers covering every state in the U.S. plus all the territories. And if you'd like basic contact information on those centers, you can find that at agrability.org/resources/FARSAN. For those that are not familiar with AgrAbility, we are also sponsored by USDA's National Institute of Food and Agriculture. There are 21 state AgrAbility projects around the country, and every one of those is a partnership between a land-grant university and at least one nonprofit disability services organization. In addition, there's one National AgrAbility project. Again, that's here at Purdue University through the Breaking New Ground Resource Center. And our partners on that grant include Goodwill of the Finger Lakes, Osteoarthritis Action Alliance, AgriSafe Network, Colorado State University, and Washington State University. There's a wealth of more information about AgrAbility at agrability.org, including more than 140 archived webinars that you can check out in a variety of different topic areas. I'd like to introduce our presenter now. Dr. Athena Ramos is an associate professor in the Department of Health Promotion at the University of Nebraska Medical Center in Omaha. And she's also affiliated with the Central States Center for Agricultural Safety and Health and the Center for Reducing Health Disparities. She leads a Latino outreach and engagement team, as well as multiple projects focused on farm worker health, immigrant integration, and community well-being. She has over 20 years of experience as a program manager and researcher with proven ability to develop and implement health, social, and human service programs with culturally diverse populations. Dr. Ramos serves on the board of directors for the International Society for Agricultural Safety and Health and is a member of the National Alliance for Hispanic Health. She has a PhD in International Family and Community Studies from Clemson University and 2 master's degrees from the University of Nebraska at Omaha. Recently, she was awarded the Caruth J. Wagner Faculty Prize in Public Health from the UNMC College of Public Health for her engagement during the COVID-19 pandemic with vulnerable workers throughout the agri-food system. With that, I'm going to stop sharing my screen and turn things over to Dr. Ramos for the presentation, and I'll plan to return for the Q&A period.
Good afternoon, everybody, and thank you so much for being here with me this afternoon. I'm really excited to be able to talk with you a little bit more about some of the work that we've been doing around reducing stress and stress management and mental health and emotional well-being with Latino farm workers here in the Midwest region. So there's a couple of objectives for today's session. The first one is that I'd like to talk a little bit more about some of the common stressors that farm workers experience and some of the cultural aspects of coping and resilience, including 2 words that you saw on the title slide and on the registration form, Convivencia y conversación. And I'll talk about those here in a little bit. The second is to highlight the Bienvenido program, and Bienvenido means welcome, so we'll highlight the welcome program, and we'll share some results about our own experience in implementing the Bienvenido program here in the Midwest. So first, to start out is to give you a little bit of demographic data about the farm worker population here in the United States. So it's estimated that there's about 2.4 million farm workers in the US. It's about a 2/3 split being male to female. Almost 40% of farm workers are under the age of 35, and there is about 266,000 youth that are hired to work on farms. Now, when we look at the farm worker population, Spanish is the dominant language. In fact, about 62% of farm workers have Spanish as their primary language. About 66% of farm workers are foreign born. You can see that the majority are coming from Mexico, but there is a growing contingent of workers that are coming from Central America. And about 44% of farm workers are working without work authorization, meaning that they are undocumented. In terms of education, there's an average education level of about 9th grade. You can see here on the slide that the farm workers have fairly low individual and family incomes, only about $20,000 to $25,000 as an individual, and about $25,000 to $30,000 for a family. About 20% of all farm worker families have incomes below 100% of the federal poverty level. We see that over half of farm workers reported not having any type of health insurance, and about 35% of farm workers had not visited a healthcare provider in the last 2 years. So that gives you a little bit of background about the group of workers that we're talking about. So most of this data comes from the National Agricultural Workers Survey, which is conducted by the Department of Labor. There are some caveats to that data source in that it only covers crop farm workers. So it does not include livestock workers, and it does not include farm workers who may be here with different types of visas like the H-2A agricultural guest worker visa. So when we think about immigrant workers in agriculture, there's a lot of factors that contribute to their vulnerability. As many of you know, farm workers are engaged in hazardous work. There's lots of dangerous conditions. There's a lot of time demands and pressure and long hours, and a lot of repetitive tasks. That's across the board. It doesn't matter if you're Latino, if you're immigrant, if you're not, if you're anything else. I mean, that's pretty standard across farm work. However, NIOSH, the National Institute for Occupational Safety and Health, has deemed that immigrant workers are a vulnerable worker population. So what makes them more vulnerable than other people? First, there's little to no safety training that many immigrant workers receive on the job site, and they may have little access to any type of personal protective equipment. There's low levels of formal education. As you noted in the previous slides, the average education level is just a 9th grade education. And there's also low levels of literacy. So even when we're talking about a 9th grade education, that doesn't mean that everybody is literate in Spanish or in English. There's poverty issues, language and cultural and logistical barriers that have to be overcome. And working with this population, we can't discount the impact of discrimination that people have experienced and the fear that they may have on the day-to-day basis related to immigration status. If, for example, if they may be undocumented themselves, or they may be part of a mixed status family, meaning that somebody in the family may be undocumented, somebody may have maybe a legal permanent resident, that there's different types of legal immigration statuses within that family, which may result in people being afraid to access services that they are entitled to. We also do see that many immigrant workers, they're afraid to speak up for themselves, and they may not know the labor rights that they have here in the United States. And there's just a real undercurrent of fear when working with this population. So when we think about mental health and just in general, I'm sure in many of the places where you all are from, you experience the same thing that we do here in Nebraska, in that there's a very big shortage of providers. And if we look at our state, so here on the screen, you can see a map of the state of Nebraska broken out by county. And you'll notice that 88 out of the 93 counties here in the state of Nebraska are designated as mental health shortage areas by the U.S. Health Resources and Services Administration. So there's only 2 counties that you'll see on the map that are green. Those are both urban areas, meaning that there is adequate number of providers. But if you look at the rest of the state, there's a huge shortage of providers. And so it becomes even more important that we figure out ways that we can get people information and resources to help them to deal and manage with mental health concerns and to manage stress in more appropriate ways. So when we think about farm workers, there's a lot of things that contribute to the stress that they may feel. So here in Nebraska, we did a study back about 5-6 years ago, and we found that about 45% of the migrant farm workers that we had talked to here in our state were depressed. And part of that was related to their health conditions, their health status, and how they felt. And part of that was related to the economic stressors and the poverty that they experienced on a day-to-day basis. So both stress and depression were positively associated with occupational injury. Now, based on the National Agricultural Workers Survey, there is relatively high prevalence of elevated depression symptoms. So about 8.3% of men and about 17.1% of farm worker women who are part of this survey. So you can see on the screen that there's a number of reasons and associations that are contributing to these elevated depression symptoms. For example, for women, there was a fear of being fired. There was the idea of having fair or poor health, having younger children in the home, being unaccompanied by your family and working in the United States. So that idea of family separation, and what type of legal status that you may have in the country. So I think it's important for us to really think broadly when we're talking about stress and we're thinking about mental health. What are the issues? It's not just about access, but it is really about the whole context in which people live, and we can think about those social determinants of health as well. So on this screen, you can see a conceptual model for a stress process that has been proposed. And we know that everybody experiences stress at some point, and individuals can try to figure out ways to mitigate their stress with different coping behaviors, which can be positive or negative. So for example, on the slide here, you can see that some of the positive coping mechanisms might be interacting more and having more frequent contact with your family, or being more engaged socially, participating in church, having, using music or gardening or other types of hobbies to distract you and to deal with the stress that you may be feeling. On the other hand, there are negative coping strategies. For example, drinking, drug use, aggressive behavior, intimate partner violence, and all of those may result in increased stress and poorer health outcomes along the way. So you also see here on the slide that stressors are divided between structural stressors and situational stressors. So situational stressors are individual circumstances or environmental conditions that can change over time, and that may change across the season that people are working in. Structural stressors, on the other hand, are more broader socio-economic forces that affect farm workers' lives, like discrimination, like poverty, like acculturation, and like legal status does. So there's a number of common stressors that have been found in the literature, but they can basically be grouped into those two broad categories. And and thinking about work, the relationship with work, the economic situation, the family relationships, immigration status, acculturation, discrimination, and health. So there's distinct types of stressors in farm work that are associated with mental health. And even though they're here on the slide, this is coming from 2008, you can see that greater social isolation and more stressful working conditions were each associated with anxiety and depression. The magnitude of the associations differed. And so social isolation had the strongest effect on anxiety, and stressful working conditions had the strongest potential effect on depressive symptoms. So it is important for us to really think about those situations and what's that differential impact that they can have in terms of mental health outcomes. So what you see on the slide is the results from a study that we conducted using data from migrant farm workers here in Nebraska. And we used the learned helplessness framework. And when I heard about this framework, I was like, that doesn't sound very good. But then a colleague of mine taught me a little bit more about it. And so basically this framework suggests that individuals who experience stressors that they're unable to avoid or to escape learn to make fewer attempts to avoid or escape in the future when they experience those stressors, which thereby increases their exposure to these stressors. This results in increasingly negative perceptions, not only of the events themselves, but also of themselves and of the environment. And so here you can see that ACEs, or adverse childhood experiences, discrimination, and immigration legal status fears may collectively enhance exposure to these harsh working conditions and stress, while ACEs and discrimination may enhance the effects of both the exposure on depression and on anxiety. So we need to really think about interventions that can help to address this perceived inability to respond to the conditions that farm workers are facing on the day-to-day basis. Through similar studies, we've also learned that gender-related expectations impact whether a person experiences a particular situation as stressful. Gender norms that are incongruent cause more stress. So for example, endorsing a high traditional machismo. So this traditional idea of masculinity and having to be strong and not show any type of weakness was associated with a stronger effect of the fear of deportation and discrimination on depression outcomes as compared to those who had low levels of traditional machismo. Poverty and harsh working conditions we looked at those as congruent stressors because those fall in line with machismo, the idea that you have to work hard and that you may not have everything you need. These seem to be in line with how people talk about these stressors. And so we didn't see that these had any direct or indirect conflicts with like the idea of social dominance or male dominance, or even those emotional restriction components that characterize the traditional machismo. And so you can, again, thinking about how we talk about mental health can make a difference, and how we frame it in terms of culture can make a difference on how people experience those particular stressors. All right, so now I'd like to turn our attention to some best practices. So there was a report that came out in 2012 about community-defined solutions for Latino mental health care disparities. It came out of California, and some of the things that they recommended as best practices for addressing mental health concerns within the Latino community were to promote the idea of wellness and try to reduce the stigma that's associated with mental health and really build the community capacity to address these concerns. We should be using outreach and education strategies and peer-to-peer types of strategies. And they also mentioned that it could be important to use family-based psychoeducational curricula or to co-locate mental health providers with other community-based services. So I think that's important to kind of frame our thinking about how we go about in engaging with Latino farm workers. And to me, it's important to really think about this idea of convivencia. And so what does that mean? I'm not sure if everybody in our virtual room today has heard about this, but what this is actually a word that was used in the context of medieval Spain to describe the sharing of ideas, of cultural and religious tolerance, and living well together in a community. If you took the literal translation of this, it would mean coexistence. But it has really contemporary relevance to what's necessary for mental health, right? Because too many people here in the world feel like they're isolated, that they're alone. And so this idea of a dynamic and interactive concept of living harmoniously in a human group is really important. This is an art of living together. And it really demands various competencies, right? And so the act of convivencia by itself is not sufficient, but it has to be this active sharing of space and of time that's complemented with intention, action, and forms of interpersonal interaction that are both a product and an effect of this collective climate on relationships and on the emotional well-being of individuals. The second core kind of construct of today is the conversación. And so this conversation and dialogue are really important tools, especially when you're working with collectivistic cultures. And like in Latin America, there's also a rich history of an oral tradition. And so having conversation and being able to have dialogue are things that are not only culturally relevant, but also help to build and foster resilience, or the process and the outcome of successfully adapting to difficult situations or challenging life experiences, which mental health concern and stress are very much related. And we can talk about conversación in lots of different ways. It could be a dialogue, un diálogo. It could be a testimonial, like sharing a testimonial as a personal story of what you've experienced. Or it could be also this idea of popular education and incorporating popular education techniques into the work that we do. And so popular education, for those who are not familiar, is this idea of teaching and learning where we're both a teacher and a learner simultaneously, that everybody comes to a group, both as a teacher and a learner. And so it's a way that we can reduce the power dynamics that may exist in a group, and also share and value in the experiences that everybody around the table brings. And so when we incorporate this idea of conversación, it recognizes and it fosters the community cultural wealth and resiliency through a number of what you could term different capitals, right? So there's aspirational capital, which refers to the ability for people to hope and dream about the future, even in the face of real or perceived barriers. It also fosters linguistic capital in that we're communicating in a language that's familiar with them, where they don't have to feel like they're an outsider. It fosters this familial capital, where we're nurturing the idea of familism and the idea of a more extended kin. It's not just a nuclear family, but it's the whole extended family. And social capital as well. So the networks of people, we're building networks of people and community resources and sharing that information. And so when you have social capital and when you build social capital among group members, it's a way that they can provide both emotional and instrumental support to help navigate through a new experience or a new place, physical, geographic place. And finally, it also fosters some of that navigational capacity and how helping individuals to really maneuver through the different social institutions that may exist. Okay. So now I'd like to share with you a little bit about the Bienvenido program. And so this is a program that was created by a gentleman named Gilberto Perez Jr., and it's been publicized in a community-defined solutions and as a promising practice by SAMHSA, which is the Substance Abuse and Mental Health Services Administration. So community defined evidence practices are defined as a set of practices that communities have used and determined to yield positive results as determined by community consensus over time, which may or may not have been measured empirically, but have reached a level of acceptance by the community. Okay, so Bienvenido, or welcome, is an educational strengths-based curriculum that's focused on emotional well-being, adjustment, and integration, with the overall goal of helping participants to attain a higher quality of life and really develop some of those strengths that they need to reduce the emotional risk and behaviors that are associated with poor mental health. So it focuses on three V's, you could say: vision, virtues, and vocation. So vision is about knowing. So being able to acquire some new knowledge, being conscious of the thoughts and the feelings that they have in terms of their own adjustment to a new life in a new place, to recognize that their own life experiences have a lot to do with the present, and that we need to be able to reflect and talk openly with others about the process of adaptation to life in a new place under new circumstances. It's also about virtues. So the idea of being. So being acquainted with different people. A lot of times farm workers don't know the group of workers that they're living with. So they spend, weeks or months at a time, but they don't get to know each other. So this is a way that they can become acquainted with one another, but they can also become acquainted with the community and what exists in the greater community, and learn how to increase their own opportunities to participate and engage in that new community. And finally, it's about vocation and being able to respond or doing something. So helping participants to really put into action what they're learning in the group, and identifying places where in the community where participants can actually practice, and giving people practical steps, practical tips about what they can do, what they have, what's within their power to really change within their life to improve their own emotional well-being. So the program itself is quite responsive to many of the Latino cultural norms. So this program is designed to be conducted in Spanish. It wasn't a program that was created in English and then translated into Spanish. It's created in Spanish, and it is meant to be done through face-to-face interactions with a group. This is part of a group process. It addresses some of the migration-related stressors, potential coping mechanisms, and community resources. The intervention, the way that we're implementing it right now, is conducted at the housing site where farm workers live. So this reduces the fear of using public services, challenges with transportation, or maybe even just the fear of going out in the greater community. The program is not I'm going to teach you everything you need to learn type of program, but in fact, it uses the idea of charlas o pláticas, dialogue, conversación, rather than the didactic type of procedures. And it includes strategies that promote social support, the idea of group belonging, getting to know your compañeros, and cultural values like personalismo, familismo, and collectivismo. So personalism, familism, and collectivism, which are all quite ingrained within Latino cultures broadly. The program consists of 9 sessions, which you can see here on the slide. And the overall goals of the program are really to have a better understanding of how to look for help, how to identify resources for emotional health concerns, to be more willing to seek help if you're experiencing any type of emotional or mental health concern, to increase people's knowledge of emotional health concerns like depression or anxiety, to increase their own self-confidence, to manage their emotional health concerns and be able to respond or cope with anger and with stress in more positive ways, to really enhance the communication within the family and have more realistic expectations of alcohol, tobacco, and other drug use. And of course, all of that is to say we also are trying to increase the participation of workers so that they feel like they are included and they're not isolated and they're not alone. So we have been doing Bienvenido now. We did a pilot run of the program last summer with a group of about 35 workers here in Nebraska. This summer we have done 3 sites here in Nebraska. So we have 85 participants this summer. You can see that the groups that we have been interacting with are basically all men that have quite a few years of ag work experience. Most of the groups, 2 out of the 3 groups that we've worked with are H2A workers. So most of the individuals that we're working with are coming from Mexico. You'll see there's also a couple of individuals who are from the US, but really spend most of their life in Mexico or right on the border. And you can also see that many of the participants had relatively low levels of education and are very English language, limited English proficient, let's put it that way. So having the program in Spanish is really critical to being able to reach this particular worker contingent in our state. So as you saw on the previous slide, there was 9 sessions. So we have been working with the program developer to condense these 9 sessions into a more reasonable number for working with migrant farm workers. So we've landed on 5 sessions. So we've condensed 9 into 5. And instead of doing 9 weekly sessions, we are doing 5 sessions whenever the farm workers are available. So sometimes that means it might be one on a Monday and the next one will be on Wednesday and the next one will be on Sunday. We've had to be very adaptable, really flexible to meet the needs of the workers based on their work schedule. As you can imagine, crew chiefs and supervisors aren't all too hip about workers doing a program that could interfere with their work schedule. And so in order to be able to accommodate and to keep everybody relatively happy, we've condensed it down into those 5 sessions, and we do it whenever they allow us to come and do the program. Typically, it takes us about 2 to 3 weeks to finish the 5 sessions. So as I mentioned, we've done 3 different groups this summer. We're in the process of actually completing the 3rd group right now. So completed 2 groups and 1 more in the works. The program is a very low resource type of program. So we've done the program sitting out in a parking lot at a motel where farm workers are housed. We've done it in the grass under trees near the hotel where farm workers are housed. We've also facilitated the program in a city park across the street from where farm workers are housed. So this isn't a program where you're going to come in with PowerPoints and, lots of copies of slides or anything like this. It's really meant to do in a very low resource type of situation. We bring food and refreshments for each session. Often the workers are getting off work at 7, 8 o'clock at night. They're hungry. And this is a great way for them to come and share a meal and to be able to relax. The sessions typically last about 1.5 hours to 2 hours, depending on the conversation and how the conversation flows. Sometimes groups last even longer than that, but not. We try to be completely done with the actual lesson in 1.5 hours to 2 hours, but oftentimes people want to hang around and they want to play a game or they want to talk to you. They have questions. And so for us as facilitators, it might be 3 hours or more. As I mentioned, the program is conducted in Spanish. It is not translated into any other language because it was specifically developed for Latino immigrant communities. We are also providing a $60 cash incentive to the farm workers who complete the program. So for us, completion is attending 4 out of the 5 sessions. So that would be an 80% attendance rate. As I mentioned, we have 85 participants who have started the program. We've had 49 who have completed the program thus far, and we have 27 who are currently in the program as we speak. So on the next couple of slides, you're going to see some of the pictures of the work that we've done over this summer. So this is one particular group, and here the farm workers are talking with their table facilitator about positive qualities. How often do we talk about our own positive qualities? Never. It's a really hard conversation to talk about the great things that you bring to the table. But it's really important for improving mental health and for fostering that mental well-being is to recognize that we all come with strengths and we all have things that are of value to our community. But we also come with some needs, and there's needs in terms of our families, our work, recreational needs, health needs, spiritual needs, and so forth. And so that's what the group is talking about here. And on the bottom of the slide, you'll see our graduation photo. So each of the groups has a final celebration where there's a cake, and we bring certificates for each of the participants. And so they get to have their certificate, take a picture with the facilitators, and then we celebrate with cake. This is another group that we've been working with over this summer. And here on the top left slide, you'll see that this group of workers was actually talking about risk and protective factors. And so part of the program is to talk about those and the different levels that you may experience risk and protective factors at, whether that be an individual level, a family level, or even within the greater environment. And then again, on the bottom right, you'll see a graduation photo from this particular group.
Here's what I found.
And on this slide, this is the current group that is ongoing right now. And on the top left, what this group is doing is they are talking about situations that they may or may not have experienced in terms of dealing with healthcare providers. So for example, have you ever gone to a healthcare provider and, well, first, have you ever gone to a healthcare provider? Second, maybe have you ever gone to a healthcare provider and not understood what they told you to do? Have you ever been prescribed medication and not really understood how to take it? And so they go through a number of situations, and they can step forward if they've experienced it and step back into the line. But this is a way for the workers to see that they're not the only one who may have experienced that particular situation. And then we go on to talk about tips for how to better talk with healthcare providers about the situations that you're experiencing. And on the bottom, we also include discussions about the importance of having some time to relax and having some time for fun, and talking to the workers about what is it that you do for fun. So often we hear about, no, I tell jokes, or I watch videos, or I listen to music, or I take a walk, or I play soccer. And so there's things that we can all do to manage our stress in very low resource situations that don't need a lot of money, that we can find ways to have fun and be able to share a little bit of that time with our coworkers in this situation, or with our families and our friends. So as part of our program right now, we are trying to do a little bit of evaluation. So as I mentioned, this is a community-defined evidence project. We're trying to build the base of evidence around this particular program. And so we're measuring a number of different constructs with the workers that we're interacting with this summer, including self-esteem, life satisfaction, social support, group belongingness, perceived stress, mental health, coping, help seeking, mental health knowledge, mental health stigma, and substance use. So some of the things that we found thus far are that self-esteem and life satisfaction among participants is pretty high. We did see an increase in group belongingness from pre to post survey, but it wasn't statistically significant. But as we all know, there's a difference between statistically significant and practically significant. And so we feel like even though there wasn't a statistically significant increase, practically this is a really big, important thing for groups of workers that are living together, working together, and sharing pretty much all day and all night together, is being able to feel like they belong. We've also found that there's been a significant positive change in problem-focused coping strategies. So the use of active coping and positive reframing. So active coping is more about concentrating your efforts and actually trying to take action to make a change in the situation, whereas positive reframing is trying to rethink about the situation to see it in a different light, to look for something that's good in the particular situation instead of jumping immediately to what's wrong. And so we've seen significant changes in both of those, which we feel really positive about. We also have found that there's relatively low levels of depression and anxiety among these two groups, which is also quite good. I think part of that may be related to the H2A status and knowing that you have a time when you're going to be going home to be with your family. And as you probably know, there's a number of other requirements for the use of that program, even though they may not always be enforced. We also have found that there's significant changes in reporting of different help seeking from sources. So, for example, we found significant changes in people reporting that they would talk to a friend or a parent or a mental health professional or a healthcare provider about their emotional state, which we also feel quite positive about that. That's a really big leap. As you may know, talking about mental health within the Latino community is very stigmatized. And so when you have people who say, yeah, I'm willing to talk to somebody, and this is a really good change. We're really pleased with that. We have also started to see that there's some significant differences in terms of mental health knowledge from the beginning of the program to the end of the program. So, for example, significantly more people are understanding that mental illnesses are common, and they're understanding the role that substances like alcohol and tobacco can play on stress. And we have seen that there has been a decrease in mental health stigma, but again, the change wasn't statistically significant, but there is a difference that we have been seeing. So we feel, again, very confident about some of those results. We've asked participants, tell us what you like, what you don't like, and what's been most important to you. So they really like the conversation topics and the ability to share the experiences that they have. Again, thinking about those ideas of conversación, diálogo, testimonio, the friendliness of the facilitators, having food and having an opportunity to relax. What they didn't like about the program is they said it's too short. Why'd you make it end so quickly? And most important topics that they've told us is this idea of being able to convivir, or to be with their coworkers and really get to know them a little bit better. Having some strategies for dealing with their problems. So thinking about goal setting and how do you actually get to the goal that you want. Communication, respect, being able to manage anger, dealing with substance use, and of course, just having a greater understanding of mental health. So some of the workers have told us, I like the conversation and the way that we were able to convivir con our coworkers. You made me feel happy and harmony and recognize the value of convivencia with my coworkers and the Bienvenido team. And it's really made me think in another way. It's made me express myself in another way with my friends and family. So that's the kind of impact that we feel is really important and can really make a difference for farm workers. So we know that stress and emotional health are really critical issues to address, particularly with the Latino immigrant farm worker community. And that's so under-resourced. And that this idea of convivencia y conversación are really important elements that can help build trust and foster those cultural bridges to address mental health and stress concerns within this worker population. We're pretty excited about Bienvenido and that it's culturally responsive, it's relevant, it's linguistically appropriate, and it's taking all of that into account as we talk about emotional well-being, as we talk about how to engage in positive coping strategies and how do you seek help, and making it okay to say you need to seek help, and enhances those relationships among workers. So as I mentioned, overall, we're quite pleased with what we're seeing with this particular program. We're excited that we're able to do it. I tell you, this is probably one of the highlight of our year, is being able to spend this quality time throughout the summer and working with these farm worker groups. So this is a team effort. This is not a me effort, but there's 6 of us who are working on this program from my team. And you can see action photos of facilitators on the bottom. And we'd like to definitely thank all of the workers who participated in the program. We know it's hard after a long day's work, 10, 12, 14-hour days, and then come to group. And they're there. They come with their little booklets, and they're ready to learn and ready to participate. So we thank them for their time, for their hard work. And of course, we thank our partners, the Central State Center for Agricultural Safety and Health, the Nebraska Migrant Education Program, Proteus, and our funding to implement this program is through the USDA grant through the North Central Farm and Ranch Stress Assistance Network. So with that, you have my contact information here on the screen, and I'd be happy to take any questions that you may have.
Thanks so much, Athena, for that excellent presentation. You gave a lot of research documentation and practical applications and innovative strategies. So I'm sure everyone in the audience benefited today. I'm going to turn things over to Ed Sheldon. I know we've had several questions in the chat area. And again, feel free to continue to add those to chat, or if you'd like to raise your hand and ask a question verbally, you can go down to the reactions icon and simply click on the raise hand icon. So Ed, take it away.
Okay. Yeah, we've had several questions come in, and we'll try to get through as many of those as possible here. I probably need to, I get a feeling I'm gonna have to come on.
Athena, you might have to stop sharing your screen so Ed can access that.
Okay. Yeah. Still not there, is it? Let's.
Well, I see Ed, I see a question here. The question comes from Gladys. Do you partner with the ag employers at all to provide this program? So the answer is kind of yes and kind of no. So we usually check in with the crew chief, supervisor, or whoever may be in charge of the specific housing site to not try to burn any bridges. But it's not an actual partnership per se. It's more of like, hey, this is what we're doing. Are you okay if we do this with the group that you have here? Noemi, thank you for the comment. I love how many of the men are smiling and laughing. That's awesome. Yes, it is totally awesome when you see this program in real life. It really does make, like I said, it really makes our team quite happy, even though the summer and the hours are long. The appreciation and the gratitude for, their time and the experience of being with them to share in that, to have that convivencia con ellos is something very important to our team.
Hello.
I see lots of comments about how the program's awesome. Thank you. Question again from Gladys. Is there any follow-up once the program is completed? So we plan to follow up this year. Last year, we just did a pilot. So it was more kind of to see how that reduction from the 9 sessions to the 5 sessions was going to work, and how do we make it more relevant to a farm worker population, because the program was designed for Latino immigrant communities, not specifically for farm workers. And that's where our team is working with the program developer now, is to make it more specific to actual farm workers. So we intend now to be following up with them probably in the next 3 months. A question from Mariah. Who are the facilitators? How are they trained? Any observations about having female facilitators in a predominantly male worker group? Great questions. So the facilitators are my team here at the university. So I have a couple of folks who are professional staff members, and then I have a couple of PhD students. Everybody is trained in the program. So we went through a 4-day training to be able to facilitate this program. And then we also did an advanced facilitator training recently, well, a couple of months ago, back in April, because we actually hosted a training for new facilitators here in Omaha, and our team was able to help lead some of that training. So we did an advanced facilitator training at the same time. And we were able to train 8 new facilitators from organizations in Iowa, in Nebraska, and in Minnesota. Female facilitators in a male group is a really important topic. We never go alone. So we always have a male colleague who is part of our facilitator team. It's not just women, because you have to think about safety. And also, I think it helps to create more of an openness to have a man also sharing experiences about mental health. So it isn't just women who you assume are going to tell you what you should do and that you should be going to a doctor anyway, but also having some men who can share those stories we found is really, really helpful. So we've got a couple of great male colleagues who are also participating. I think, Ed, you've got the questions now here.
Okay, I'm semi-organized again, finally. Yeah, you got through several of them. We'll kind of go back up to the beginning because I had a couple come directly to me. This relates to early in your talk. Where should someone look for a mental health provider for a farm worker who speaks Spanish and maybe undocumented?
Yeah, it's a huge challenge, especially in a state like Nebraska, where I showed you 88 out of 93 of our counties are mental health provider shortage areas. And you can bet that finding somebody who speaks Spanish in the rural areas where there's already a shortage is like few and far between. I think the last time we checked, we had maybe 1 or 2 actual psychiatrists who spoke Spanish in the whole entire state. So one of the things that we're doing through the North Central Farm and Ranch Stress Assistance Network is trying to create a directory of multilingual mental health resources across the 12-state region. And so we're currently working on that. We hope to have that completed later this fall, but that will be a great resource, and it'll be hosted on our North Central Farm and Ranch Stress Assistance Network website. And that's where you'll be able to find it. But it really is a challenge. And so some of the things that we try to do is, like in our case, none of us are licensed clinical providers, but we do have one on call in case there is a situation that we're not equipped to handle. And so he's available for us if we need that. We also try to provide some, resources like hotlines that may have access to Spanish speaking resources, for example, through the National Alliance for Hispanic Health. That's one. I know there's a number of farm and ranch stress hotlines that are available, but our workers don't tend to be using those. So they would prefer something a little bit more culturally specific.
Okay. This one was mine. You had some terms that I wasn't real familiar with. Would you mind expanding a little bit more on learned helplessness and acculturation and what?
Yeah, sure. So acculturation is really this process of adaptation to a new place. And so there's lots of different strategies that are used within this big umbrella of acculturation. So if you think back to like when my parents came to the United States, it was the 1950s. And back at that time, you couldn't be different. You couldn't speak a different language. You had to learn English. You had to basically give up your whoever you were in your culture to become quote unquote American. And so that's one strategy that's called assimilation. And there's 4 different strategies that are typically used. But acculturation is kind of like this, where you get the best of both worlds. So you maintain, your culture, but you also adapt some of the new culture. And it's kind of this melding process of adaptation to a new life. The idea of learned helplessness is a framework that when you experience these negative things that you can't really escape and you can't really avoid, then you learn that you shouldn't make attempts to avoid or escape because there's no point, right? And so this is something that increases people's exposure to negative experiences.
Okay. Let's see. We'll move on here. I think this one, and you probably already, I think you already talked about this. What can employers and farm workers do to help mitigate distress on the job? And that kind of dovetails with this one about partnering with ag employers. So if you want to expand any more on that, or
Sure. I mean, there's a lot of things that employers can do because they have a lot of control over these situations. So for example, making sure that people are housed in decent situations, that the housing is safe and decent for human living. That would be one thing. Trying not to work your people like forever. And, you know, a lot of the farm workers that we interact with, they'll work 7 days straight. They'll work 10 to 14 hours a day. It really doesn't give people time to relax. So if there's a way to maybe reduce the hours or get at least a day off, a time to go to Walmart, like we hear from farm workers often, you know, like going to Walmart is a big deal because they're in isolated rural areas. They don't have transportation. They don't have real cooking facilities. So they have to go get something. You know, there isn't a McDonald's down the street or anything like that. Like, it's a big deal to be able to go to Walmart. And so thinking about ways that you can improve access to things that people need, laundry facilities, food, transportation, so that you're not like I was recently with a group. I'll tell you a story recently with a group, and they haven't been working for the last month. So they're being housed in a shabby motel, you know, in a little tiny town where there is no Walmart, there is nothing. There's a gas station across the street, but there's 176 men in this motel for a month, not working. They're bored out of their mind. There's not a good internet connection, so they can't even, spend time on Facebook or WhatsApp or calling home and chatting with family or friends. So those types of things can create a really bad situation, but they could be easily mitigated, right? Instead of holding people kind of hostage for a month, like find opportunities for them. Maybe there's ways to rotate through workers, so not everybody has to be off at the same time, or maybe only recruiting the number of people that actually are going to work, because they're feeling terrible actually, because they came to work, they came under the assumption that they're going to work, that they're going to make some money, but they worked a month and they've been sitting around for a month. So the money that they made in the first month, they've already spent now that they haven't been working. So it kind of defeats the purpose.
We are at the top of the hour, so I think we'll stick around and answer some more questions. But again, if you would please click on the survey link in the chat before you leave today. We'd appreciate your feedback. So turn it back over to Ed.
Okay, let's see. I think you've addressed the next couple. I just select, when you went from 9 topics or 9 sessions down to 5, how did you select what to use, and how did that affect, or did that affect the outcome and effectiveness of the program?
Great question. So we did not cut anything from the program, but instead of doing the 9 sessions, like 1 session per week, we do 2 sessions at a time. So we do session 1 and 2, 3 and 4, 5 and 6, 7 and 8, and then 9 is a celebration. Well, it's lesson 9 plus celebration at the end. So we haven't cut any of the topics out of the curriculum. So we feel like we're still being true to the intent of the program. In fact, this came at the direction of the program developer. So it wasn't our team saying, which ones should go together. He said, no, you can put these two together, and it'll do well.
Okay. Let's see this one, and I think this is referring to long-term follow-up. You do
right. I think I answered that one already.
Okay.
That we do
Very
intend to follow up this time.
Okay. Yeah, I was chasing around trying to figure out the computer, so I think I missed that
No
one.
worries.
Okay. Let's see. H2A workers are often noted to have more access to things like food, education, safety, education, etc. Did you find differences between the H2A workers and the seasonal migrant workers living in the U.S. permanently? And can you share any strategies you have to reach other farm worker sectors?
Great questions. The major difference that at least this summer that we've seen between the H2A groups and the group that was not an H2A group was in terms of food. As you know, through the H2A program, there's requirements on either cooking facilities or food that has to be available. And so the group that was not an H2A group did not have food. And so with that particular group, we made sure to actually bring a full meal for those workers each time we came. So this group, they love chicken. It was pretty funny. We asked them, in the beginning, like, what kind of food do you like? Just, to try to gauge it. I went around and everybody chicken. So the whole session, all 5 sessions, we had chicken. But that was something that we did to try to help the workers, because we knew that they're not getting paid a lot of money and they're not being provided food. So we made that as part of our strategy. In terms of other farm worker sectors, so in the summer we've been doing Bienvenido with migrant and seasonal workers, but we also do outreach with and research with livestock workers throughout the whole year. So I've got a couple of projects that I work on that are related to cattle feedlots and Latino immigrant workers on cattle feedlots here in the Central States region. I've also done work with dairy and with hog confinement, but typically the strategies are very similar. It just takes a conversation and trying to build trust.
This one kind of dovetails with what you were just talking about with lunch. How is it funded?
Yeah, we wrote it into our budget. This is a really important thing for working in the community, is being able to have money for food. And we've been doing work in the Latino community for over 20 years. So this is something we knew that we had to have, and so we wrote it into our budget.
Okay, that's, I think, all the questions I had, but I know several more came in, so I'll open up my chat and see if probably we can look, see where we're at and see what we've maybe missed. See, some great compliments there, great program. Okay, here's one. Any considerations?
There's a question from Astrid about evaluating the results when we've completed. Yes, that is the plan, is to use the data that we are collecting, the pre and the post surveys that we're conducting with each of the groups, to do more of a full evaluation of the program and be able to build that body of evidence for this particular program.
Okay. Let's see, move up a little ways. From Gladys, any considerations, integration of cultural practices for holistic health and wellness? Many in the Latino Hispanic population resort to these practices before seeking healthcare in the U.S., both for mental and primary care.
Yeah, absolutely. And that's part of having a strong facilitator team, is being able to understand culture and kind of know what you're getting into ahead of time. And so everybody on this facilitator team comes from, they are of Latino descent, from various parts of Latin America or within the US. But everybody has that common understanding of culture. And understanding that it's more of an integration, that recognizing that people are using teas, people are using massage. And so talking about it, making it normalizing the conversation about it, but also integrating that with professional help is one of the strategies that we use. So it's not to say that that's wrong, but it's more, how do we complement, professional help seeking with holistic health practices?
Okay, looks like we have several comments and compliments on your program. Let's see, Gladys, love that directory once it is complete. Would be happy to share it on the NCFH Mental Health Resource Hub. Let's see if there was another one I saw somewhere. Oh, do you have contact information for your counterparts in Minnesota?
Absolutely. Yep. If you just send me an email, and I'm going to put my email here in the chat. So feel free to shoot me an email and I would be happy to connect you.
Awesome. Let's see. Okay, and here's one for you, Dr. Ramos. If you're interested in sharing more about this program, we are currently accepting an abstracts for annual Midwest String Forum. So
absolutely. Thank you for the reminder. Yes, I would be interested.
And we can get you a copy of these comments. And here's one from Paul that says, let's go ahead and wrap it up, but we're going to ask one more question. Do you have any statistic you can share on farmers with disabilities nationwide for Latinx and all other groups?
That I do not have, but I think that would probably be a good project, but I don't have that data at my disposal right now.
Okay. All right, I think that's most of them. Like I said, we can get you a copy of all these, and I'll turn it back over to Paul before he takes over.
Okay, thanks a lot. Again, Dr. Ramos and Ed, and for everybody that's joined us today, we appreciate your participation. We do conduct these webinars quarterly through the North Central Farm and Ranch Stress Assistance Center. So if you register for this one, you will get information about the future ones. Again, we are recording this. We do ask you to go ahead and please complete the survey. And with that, we will say thank you and wish you a good rest of the day.
Thank you so much.